Yeah, when you're ready to go. I don't know when I'm supposed to move to the podium, so I'll just wait. Yes? No. Are you ready? Good? No? Good morning, everyone, and welcome to Thunder Bay Regional Health Sciences Center. My name is Rhonda Crocker-Ellicott, and I'm the president and CEO here at the Health Sciences Center. We're so very pleased to have you with us this morning. To get us officially started, I would like to take this opportunity to offer a land acknowledgement. Thunder Bay Regional Health Sciences Center operates on sacred land. We are gathered on the traditional lands of the people of the Fort William First Nation, the traditional territory of the Anishinaabe Nation, and signatory to the Robinson Superior Treaty of 1850. Thunder Bay is home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work together in this community and on this territory. We're privileged this morning to welcome Honorable Sylvia Jones, Minister of Health, and MPP Kevin Holland to Thunder Bay Regional Health Sciences Center today for a very exciting announcement. On any given day here at the Health Sciences Center, we provide care to patients across Northwestern Ontario who reside all over Northwestern Ontario and in many communities in the far north. On average, we actually provide care to over 80 patients in our beds on any given day here at the Health Sciences Center. Many patients and their families are required to travel very far distances to access care here at our hospital. Additionally, for those who are living in Thunder Bay and across the region, if they require more specialized services, more complex quaternary care services that's not otherwise available in our community, they must even travel further distances to access our care. Those living in the north are in a unique circumstance, and we know Minister Jones and this government understands the unique challenges that we face here in the north. To better enable access to care, the Northern Health and Travel Grant has long helped to subsidize care associated with traveling long distances where care is otherwise not available in one's home community or in a close distance. This grant helps patients to have the support necessary to access healthcare where and when they need it. To date, the travel grant has helped patients access healthcare services for better connected, patient-centered care. We are grateful for the Northern Health and Travel Grant Program as it helps our patients access care across Northwestern Ontario. I would like to thank the province for supporting this important and critical program and thank MPP Kevin Holland for his strong and continued advocacy for our community and Northwestern Ontario. At this time, I would like to welcome Minister Jones to make an exciting announcement. Thank you. Welcome, Minister Jones.
Well, thank you very much. And thank you, Dr. Crocker-Ellicott. I want to start by saying it is a real pleasure to be able to join you here again in Thunder Bay, and thank the entire team at the Thunder Bay Regional Health Science Center for hosting us again, and for everything you and your teams do to help connect patients and families to the care they need. I also want to recognize Paul Carr from the Patient Family Advocacy Council, as well as Kevin Holland, who, of course, as your MPP, continues to be an incredibly strong advocate for the needs of Thunder Bay and regional area all across Northwestern Ontario at Queen's Park. Under the leadership of Premier Ford, our government is making record investments in healthcare. We are taking bold and innovative action to build a better connected healthcare system that provides Ontarians with a better healthcare experience at every stage of life, no matter where they live. Our government continues to strengthen healthcare in northern communities, providing Northern Ontario families with improved access to healthcare services for years to come. This includes ensuring the care you need is there for you for today and for the future by investing in education, staffing recruitment and retention, scope of practice expansions, and new care models. We are reviewing and expanding Orange Air Ambulance's fixed wing fleet from 8 to 12 aircraft, ensuring Orange can continue to provide the safe, consistent air ambulance services, which are especially important in our northern communities. We are increasing access to pediatric services for children and youth in the North. As part of our government's investment of an additional $330 million each year in pediatric health services across Ontario. I know that when this was announced in January with MPP Holland to announce this funding for Thunder Bay and Northern Ontario, it is making a difference already. And we are continuing to enhance the health and well-being of Indigenous and Northern communities through our investments, focusing on culturally responsive care tailored to the residents of these communities, such as public health, chronic disease management, and material care. Today, I am pleased to announce that as part of our government's 224 budget, we are taking another step to better connect Northern Ontario families to the specialized care and services they need by investing $45 million over 3 years to expand the Northern Health Travel Grant Program. These programs provide financial reimbursement that helps cover the medical-related costs Northern Ontario residents can incur while traveling to access OHIP-insured healthcare services that are not available within a 100-kilometer radius of where they live. The province will begin implementing expansions and needed improvements to the Northern Health Travel Grant Program starting this fall. These improvements include introducing a more convenient online application form that includes digital receipt submissions and makes reimbursements faster, eliminating the need for a signature from the referring physician care provider, making the application process easier, and adding more eligible healthcare providers and more facility locations, such as community labs, to help more people get reimbursed for their incurred costs, and removing the 100-kilometer deductible so people can get reimbursed for every kilometer traveled to help offset higher gas prices. These changes are also increasing reimbursements for overnight trips to better reflect people's needs and increase costs. This includes increasing the accommodation allowance from the current $100 to $175 per night, reducing the travel distance requirement to be eligible for the overnight accommodation allowance from 200 kilometers down to 100 kilometers, and expanding eligibility to cover medical travel companions accompanying a patient who is hospitalized. We know that for too long, patients in Northern Ontario have faced unique challenges when accessing healthcare. That is why our government is asking and putting in action to expand access to care in every corner of Ontario. And our investments to expand and enhance the Northern Health Travel Grant will ensure more people in Northern Ontario can connect to the specialized care they need when they need it. Thank you again for all of your healthcare partners and the incredible healthcare workers here in Thunder Bay and across the North for everything you do to provide patients and families with exceptional care each and every day. Thank you and stay well. It's now my pleasure to hand over the podium to MPP Kevin Holland to say a few words.
Thank you, Minister, and good morning, everyone. I'd just like to echo Rhonda's acknowledgement and acknowledge that the original custodians of this land and pay my respect to the elders, past, present, and future, for they hold the memories, the traditions, the culture, and the hopes of Indigenous peoples. We are very pleased to have Minister Jones return to Thunder Bay for another visit just 7 months after her last tour in our community. This announcement made by Minister Jones today of the substantial $45 million investment to expand and improve the Northern Travel Grant Program is certainly welcome news for our region. My office has worked with many constituents in the area to support navigation of this program. We are therefore very much aware of what today's announcement will mean in terms of mitigating some of the stressors associated with medically necessary travel. While the expansion of the Northern Travel Grant Program is certainly a positive and encouraging achievement, we also want to reassure our residents that efforts are continuing to increase access to care closer to home, and that will always remain top of mind for our government. I'm very proud to continue working with and alongside Minister Jones and our healthcare providers and our government as we continue record levels of investments to publicly funded healthcare system. Over the last year in Thunder Bay particularly, we have seen significant achievements in access to primary care and team-based models of care, all of which provide necessary and welcoming pathways for participation in a holistic approach to well-being. We'd also like to thank those in the hospitality sector who are working with our seniors and families who need to travel for medical reasons. To those hoteliers who offer discounted rates for medical travel, please know that you are providing an invaluable service to our people when they need it most. So on behalf of our residents across the region, I want to thank Minister Jones, her team, and our government for their unwavering commitment and action to improving our healthcare system both now and tomorrow. As well, I want to extend a thank you to Rhonda and her team here at Thunder Bay Regional for their continued collaboration and meetings that we have on a regular basis to help the region in achieving the healthcare needs of our area. So again, thank you for being here and take care.
Good morning. My name is Paul Carr. I'm a patient and family advisor here at Thunder Bay Regional Health Sciences Center. It is my pleasure this morning to bring you the patient's perspective on the Northern Ontario travel grants. I'm pleased to tell you that at our hospital, patients are at the center of everything we do. This philosophy is the basis of practice at every level. Sometimes we know that people living in Thunder Bay and surrounding area can't get the care that they need here at home. Sometimes they face many barriers in terms of accessing care and have to travel long distances to attend appointments, receive specialized care and surgeries. It would be great if patients could access the same level of care and services throughout the province, but we know this is not the case right now. And some of our patients have to travel to access care, and this can be a daunting experience. For some, it may be the first time they've ever traveled to an urban center. And of course, it can be expensive. This can be a deterrent to accessing care, as well as an added burden during a very stressful time for both patients and families. Many patients rely on the Northern Health Travel Grant Program to help provide financial assistance to receive access to these medical services. The program also helps when needing to bring a family member or caregiver for support. It is crucial to ensure access to care that is patient-centered and family-centered. Just on a personal note, I had occasion to have to travel to Southern Ontario for a cardiac procedure a number of years ago. I can tell you it is stressful. In my case, I needed to have a healthcare partner attend with me. And we were so fortunate to be able to access funding from the Northern Health Travel Program. So I say thank you on behalf of myself and my family, but also on behalf of all patients in Northwestern Ontario. On behalf of everyone here, I would like to thank Minister Jones and MPP Holland for joining us today, along with the Government of Ontario for their ongoing support of this vital program. Thank you for being here today.
We'll now begin to take questions from the media. All media present can now begin to line up behind me at the microphone. As a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question. First question.
Hi, Lee Thunnock with Thunder Bay Source and TB Newswatch. Just your thoughts on how you arrived at the figures we were. I mean, there's going to be people that say it's not enough. There's going to be people that say it's perfectly fine. But how did we arrive at the numbers we arrived at?
So it's definitely an enhancement of a program that has been in place for many years, and frankly, a program that hasn't seen a lot of changes in recent years. So not only, of course, removing the 100 kilometers is going to make a huge impact in terms of accessing the mileage rate, but I think equally important is ensuring that people can do more of it remotely. They don't have to go back to their family doc, their referring physician to get that signature. So we're making it easier for people to access the program. And frankly, much of the motivation for making these changes is hearing from patients, from MPPs like Kevin Holland, who say we are hearing this as a barrier of access, and we never want people to have that barrier to ensure that they get access to care where they need it.
On an unrelated note, can you talk a little, somebody mentioned cardiac care, cardiac surgery here. Can you talk a little bit about the progress that's being made and, you know, from your government standpoint, what can be done to maybe speed up the timelines here?
So there's a lot of pieces. Some of it is related to the diagnostic, the ensuring that the information is there for clinicians and specialists. In the province of Ontario now, we have an e-referral program, which ensures that family physicians, when they are looking for a specialist for perhaps cataract or other surgeries, can easily access where the surgeons and the specialists are in the province of Ontario. And again, that is work that we do on an ongoing basis with organizations like the Ontario Medical Association, because we want to make sure that people can get the match to a specialist, to a clinician as quickly as possible. Those investments are ongoing. Those conversations with the Ontario Medical Association are ongoing. And as we see how we can make improvements, we make changes and we make announcements like we are doing today.
Hey, it's Vasilios Bellos with TBT News. Thanks for taking my question. Minister, I've heard a lot of families who do benefit from this grant. They do say it's very helpful for them. But in terms of maybe permanent solutions the province might be looking at to improve or maybe expand healthcare in the North and Thunder Bay to ensure this grant maybe doesn't need to be utilized as much as it is right now?
Yeah, it's a great question and a great comment. So one of the things that our government has been able to do is, for example, an additional 49 MRI machines. And in many of those MRI machines are being placed in hospitals that have never had access to an MRI machine. Similar conversations and announcements are being made with CT scanners. So we want to make sure that as much as possible, we have the access locally for people. Having said that, there are certain procedures and certain illnesses that we do want to make sure people have access to, even if it is not local. And that's why I think it's really important that we enhance the Northern Ontario Travel Grant to make sure that when people have to travel, they are not financially being burdened as well as medically being burdened.
And this one might just be a little more clarification on my end. 45 million over the 3 years, is that distributed evenly? And then how will people know if they're eligible under these new regulations?
So it's actually an application-based program. So as individuals use the service, then they apply for reimbursement through the program. And as I mentioned, some of the enhancements that we are making is to ensure that it is not as paperwork heavy as it is right now. So we've enhanced how people can apply, and the speed and the turnaround that we are seeing. The money gets reimbursed and sent right into people's bank accounts. So again, that convenience factor, but it is an application-based program. So the money is an estimation of what we believe will be needed over the next 3 years, but we will know better as we see the applications come in.
Thank you.
Hi, Chris Ketton with CBC Thunder Bay. Just curious, building on what Vasilios asked about the demand for this program, can you tell us across Northern Ontario in a given year, how many people generally take advantage of the grant?
Oh, I'm sorry, I can't, but we'll try to get that figure for you. The feedback that we receive is sort of two parts. And one is, it would be great if you first didn't have to travel that first 100 kilometers before you get a per mileage increase or any reimbursement. And the other piece is, for so many things that we apply for, whether it is through other applications, much of it can be done online. And with the Northern Ontario Travel Grant, that was not the case. There was a lot of paperwork that you had to go back to your family physician, ask them to sign off on things. You had to mail in your invoices for where you stayed. So we've also ensured that those enhancements are part of the changes, because we know people are used to and want that convenience to be able to do it in home. And we don't want this to be an additional burden as you are going through your treatment path. So that's why we've tried to simplify some of the process.
Any more questions?
I noticed in the release here, it says that I think it was 66,000 people used these grants over the last in 22 and 23. Seems like a lot. Does that suggest maybe that there is a lack of services here? And I know we've talked a little bit about it here, but how big a push is it going to be to broaden the scope of services?
We often talk about a healthcare system, and to me, this is one piece of the system. So as we expand hospital capital in the province of Ontario, 50 hospitals are right now in the process of being built new, renovated, or expanded. That is a capital piece that ensures that we will have over 3,000 more hospital beds across Ontario. When we do that, of course, we need more health human resources. So we are expanding, and we have expanded access to school in Northern Ontario, Southern Ontario. A Learn and Stay program is a program that is very specifically targeted for people who, because of many reasons financially, might not have chosen a healthcare profession. And a Learn and Stay program means if you train and learn in a community that is underserviced, then your education, your tuition is covered. So we're ensuring that we're expanding the health human resources. I'm particularly proud of the Northern Ontario School of Medicine. We've had over 100 new seats available for physicians who want to train in Northern Ontario, and 60% of those are for primary care family docs. We know that when people train in communities, they tend to stay in those communities. So we very strategically looked at how can we ensure that we are giving more opportunities for young people. The Learn and Stay program, while it originally was for only registered nurses, in Northern Ontario, we've actually expanded it to paramedicine because we see that there is an additional need and we want those opportunities in Northern Ontario. So all of those pieces together are showing that we are actually looking at the healthcare system as a true system and making the investments all the way along so that for decades to come, we won't be in a situation where we're going to have to rely on Northern Ontario health travel grants. We're going to have that service here in Northern Ontario. Thank you.
That concludes our media availability. Thank you, everyone, for attending.